particular technique that we're going to describe is utilizing the bag valve mask, otherwise known as the BVM. It has three major parts to it. You've got the bag here, which you're just going to squeeze. You've got the valve, which is right in the middle, and then we have our mask. This is very beneficial of a device to use because all of the air that's actually in the bag when we're going in is going to be usable oxygen. When we're using our pocket mask and we're doing mouth-to-mouth resuscitation, all of that air that's coming out of our lungs we've already used. The air in here is ambient air, not used. Another beneficial thing that we can do is we can actually insert an oxygen tube onto here, which will fill up this supplementary mask. And then as we squeeze and we breathe in, all that air is going to actually come in, and that's going to be oxygen at 100%. We have our victim here that we've already established does not have an airway. We've checked, we've looked, listened, feel for breathing. They're not breathing. They're in a supine position, and we're also concerned about getting the appropriate airway, so we've already inserted our oropharyngeal airway. Once that's in place, we can grab our mask, and now it's beneficial to determine if you're going to do a one-person or a two-person technique. Since I currently only have I'm here by myself, I'm going to demonstrate what that looks like, and then I'll modify it for the two-person technique. The key here is that the mask needs to be appropriately sealed. We want to make sure that the large part of the base goes at the chin and the top part of the mask secures and goes over the nose. In order to seal the mask, I got to take my entire hand and wrap it as much over the mask as we possibly can and press and push that down over their face. If there's any air that seeps out, that's going to create an issue that does not allow the air to go in, and that's a little bit of a problem for us. So once we're good and secure, then I can go ahead and I can squeeze. If I have a large enough hand, I can go around and actually can squeeze and push as much air out of this as possible. If I don't have a large enough hand and I need a little bit more air to come out, one of the things that I can do is I can use my thigh. If I do that, what I can do is I can press down and I can completely collapse the bag. But I think for now, I think I've got a good enough, hand size to be able to do it. So our rate of breathing is 1 breath every 5 seconds. So I'm going to give my 1 breath in, go 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, breath. 2, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, breath. 3, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, breath. Now you'll notice with my counting, the reason that I did not go up to 5 is it takes about a second for me to actually squeeze the bag. So that incorporates that last 5 seconds. You also notice that as I counted, each time I went up 1. The reason for that is that it gives me a count of how many breaths that I've done. Normal breathing is 12 breaths per minute, so I want to count up to 12, and that tells me that I've done it about a minute. If I want to check for pulse, I would do that every 2 minutes, so then I would count up to 24, get in 24 breaths, reassess the situation, and check to make sure that everything was okay. If they needed to continue doing the bag valve mask, I would go back to this and do that just like that. If I did have another person with me that could assist, they would be standing off to the side. One person would be fully responsible for squeezing the bag. The other person is responsible for sealing the mask. The way that we seal the mask is we do it in what's called the EC technique, where I make an E with my 3 fingers and a C with my index and my thumb. I seal that all the way around, grabbing onto the base of the jaw. That allows me to completely seal the mask. This is the most effective way to use the bag valve mask because you have one person fully dedicated to the bag, the other person fully dedicated to doing the mask. At any point in time, if they show signs of life, you would stop, monitor. Again, if they start breathing again, you would immediately pull the airway out, check them, and make sure that they're treated appropriately.